morning and welcome to Hatching for Health with your host, Jessica Hatch. Tonight's guest is Dr. Pavon Grover. Now, he is an interventional pain management doctor here in Houston, Texas. So we are blessed to have him, and we are going to visit with you about pain management.
That's great. Nice.
Yeah, thank you for being here.
Oh, you're welcome.
It's a pleasure. I know we get to work together as colleagues, but also to have you come on set and really dig into what exactly you do.
Oh, it's my pleasure. I'm happy to be here.
Absolutely. So tell me, pain management, that term is so broad. You've got, doctors that, treat in different ways. You're on the interventional side.
Yes.
So, you're, constantly doing procedures on patients, some as simple as injections and some a little more invasive with pumps and things.
Yeah.
I guess, but kind of tell us just when your practice started and a little bit about the beginnings.
So now I'm going to feel old. I've been in practice for quite some time, right?
Yeah.
I did my base was in anesthesia, and then I did a fellowship in interventional pain management, actually in Sydney for a whole year.
Oh, really?
The sacrifices I've had to make. I had to suffer in Sydney for
for
a whole year.
For you.
And then, but I'm dedicated like that.
Yeah.
But it was actually, I trained with this top interventional guy. But here's when somebody has a pain problem, right? We'll just wind back for a second. So, in the first few weeks, right? You go to a chiropractor, you try physical therapy, you try anti-inflammatories, right?
Yeah.
If after a month of that, the pain continues, right? So normally some get an MRI, right?
Yeah.
Now this is interesting. When somebody gets an MRI, they tend to, just look at what the MRI shows and say, okay, it's the disc, right? Usually, I've never seen an MRI that shows one distinct problem, right? You're going to see issues there with the disc. There's going to be maybe some arthritis, some sciatic. So what we don't know from the MRI is all these findings, which one is causing the pain, right?
Correct.
So if we're looking at trying to fix the problem, right? The first step is trying to figure out where that pain is coming from. So the first step is, let's say you have an MRI and you have, let's say a bulging disc, right? Which is there's little cushions that we have in between the spine, right? So that has sometimes the tendency to bulge out and pinch the nerve there, right? So, and everyone's heard of that, a herniated disc, pinch nerve. You can have problems in the joints in your lower back. And then there's also something called the sciatica, right?
Yeah.
But sciatica involves the joint here near the hip, pinching the nerve actually here at the piriformis.
Yeah, you hear that more often than not.
The thing is, that pain is exactly the same type of pain you'd get from a bulging disc, right? So
how do you know?
Generally what's that's a good question. Usually, you go and get what's called epidural injections, right, which are just a wide shot of steroids. We don't really do that because it doesn't give us information regarding to where this problem is, because before you can get into fixing something, you need to figure out what it is, right? So we do a series of what's called mapping procedures, where let's say, for example, you have a disc. So under x-ray, inject the disc that's protruding out with a combination of a diagnostic numbing medication, like when you go to the dentist, you know how they numb up your teeth?
Yeah.
We have a longer acting version of that. And so what that does, it just blocks, for example, just that disc. Right?
I see.
And that's going to work for a day or two. So the amount of pain relief you get for the first 2 days will tell me what % of your pain is coming from that area.
From that exact area.
So that at the end, you have a map. You say, well, your disc is causing you 50% of your pain, or 25, and the sciatic is causing this, right?
Yeah, that's very interesting.
Mixed along with that is an anti-inflammatory treatment, which will kick in after the second day. So that will tell us whether the problem is inflammatory.
Solely there,
right?
and how much of it.
If it's inflammatory, then that by itself will fix the problem, right?
Okay.
If it's a little bit more degenerative or a little bit more damage, then once we know what the problem is, then there's a set of minimally invasive type of things we can do to try to fix the problem at the source, right? As opposed to, going in and trying to fix everything we see on the MRI through surgery. And we work with surgeons, so sometimes I'll be able to identify if they have, let's say, 3 discs. I'll be identify which disc is actually the culprit,
I
right?
see.
And then so that when you need surgery, we can use like a minor surgery. We don't have to go in there and
something
do
very minimally invasive.
Yeah, so the interventional is finding out where the pain is and looking for a long-term solution and avoid surgery if we can.
Of course. So what is like the most common pain procedure you do, would you say, like when you look at the masses of people you've treated, and maybe it's not something that's an extreme pain level, but what is kind of probably the most, common procedure?
So generally, you can break it down into a few things. So if you're having back pain, a lot of times that's due to the joints, like in your lower back. If you get pain in the hip going down the back of the leg, that's more of a sciatic kind of issue.
Okay.
And then any sort of disc can cause a pinched nerve, right? You asked me the level of pain, how bad does it have to get before you want to get treatment, right? Well, so the thing is, we don't really want any level of pain because think about it, if you, let's say, have pain down your right leg, right? Your body's going to shift its weight to get off that right leg. Now we've thrown the whole spine, off kilter. So now we get more torque pressure on one side. One side gets weak, the other side stays very tight. And so you start this like chain reaction.
Yeah, so it's like addressing it up front, not like waiting till it gets to a point where you can't bear it anymore, because that just
by that
throws
time
off
things are
other parts of the body.
Other parts have been involved and stuff like that.
Yeah, I know that. I remember that pain mapping, when you kind of like set the mold for that. I feel like that was something that a lot of people maybe do it, but like the way that you explain it and actually properly, use that and have them come back.
It's interesting you say it, because when we talk to patients, patients want, like I said, to fix the problem, right? But they want to understand. So I think the good thing is we sit down, go over the MRI, but we'll work through why this could be the problem, what we would do. So you have kind of an overall game plan. So it's very methodical, but people want to fix the problem. They don't want to do just like repeat injections, or surgery and all that kind of stuff.
Yeah, it's like they want that immediate like problem fixed, but it's like they want to understand why it's there so they can avoid it, moving forward. Yeah, because I think a lot of people, and those are the ones that get better. The ones that just are like, just do whatever you got to do, then they're going to be right back in there because they don't even know how it started. So I completely understand that. And so your practice, you actually have quite a few different locations, but I know you have one primary location off Bel Air Boulevard, 59 area.
59 Beach Night, in that area. And then we're up in Memorial City and a few other places.
Okay, very good. So patients, and they're traveling in from Sugar Land, Katy, even the Woodlands. I know that there's patients we've worked together on. I've done maybe imaging, but they really drive from all over. So I just think you're that good.
That's so sweet. Thank you.
Yeah, so it's good that you've expanded and have like Memorial City presence, and but really when you're able to get the relief you're looking for, people are willing to travel.
It's very rewarding. I really like what I do, because just to see the improvement you make in somebody who's affected by pain, it's like very rewarding for me. Especially if you can make a change in their lives. It has such consequences. It affects your relationships, right?
Yeah.
Because even if you're in any sort of marriage, after a certain time, you tune out from hearing about the pain, right?
Yeah.
And then it just causes this kind of cycle downhill where you get depressed, can't work, so it's a vicious thing that sometimes you can't see.
Yeah.
Right? So we're used to, if we can see it, then
people can understand it.
Yeah.
But it's when it's an invisible thing like that, like having your partner or your colleagues really understand what's going on. They
start, you get most patients, they get the impression that maybe it's in their head, or they're crazy. They probably are crazy, but it's just a relative. But that is like a misconception that pain is really just in your head, or if they don't see anything on MRI, people tend to discount it, right?
Okay.
But like certain things, like for example, the SI joint or the sciatic, sometimes you're not going to have something on MRI, right?
Yeah.
And so then get dismissed, like there's nothing there, your MRI is fine, but like I said, it could be a sciatic, which is not going to show up sometimes on an MRI.
I see.
or an X-ray. So, you know, the key is really just breaking it down and figuring out where the problem is.
And I know another diagnostic test you'll tend to order, like the EMG, that's more related to the nerves specifically. So what, I guess, when does it come to a point where you're like, that's going to be beneficial to get an EMG ordered?
So an EMG is part of the initial diagnostic workup, right? For basically what you do in EMG, you stimulate the nerve, right? And then you record how fast it takes to get to, let's say, the bottom of your foot, right?
Okay.
So if that's delayed, then it tells you there's something wrong with the nerve,
Along the way,
right?
okay.
It can point to a disc herniation that's irritating the nerve. You can see that. If it's neuropathy, which is actually damage in the nerve endings, you know, like diabetic neuropathy. You can see that also on an EMG.
Really?
So it's another tool along with the MRI, CAT scans that kind of helps us get to.
Helps diagnose things.
It's interesting. One by itself is not like nails a diagnosis, right? So because you have issues on your MRI, so usually more than one. Then the EMG might show a few things, right? So you put it all together, do the mapping, break out the percentages, and then once you know what it is, then obviously, you know, we're in a much more intelligent position to look at what the best option is.
Yeah.
Right? And there's a lot of different options now, right? Like with laser treatments and stem cells. But it starts again with locating what the problem are. Because, like, for example, if it's a disc, there's certain procedures that will help the disc. If it's sciatic, there's a whole set of different things. So, you know, you can then navigate.
Of course,
once you break down where the problem is.
Of course. We do have to take a commercial break, but when we come back, I want to talk about, you know, the population of patients you do see with insurance and cash and even personal injury. So we are going to take a quick commercial break, and we are going to see some footage of Dr. Grover in practice, as well as some of the hobbies that he's a part of. And we'll be right back with you. Imagine hearing the news as a parent that your child has been diagnosed with a condition that is degenerative or life-threatening. Now imagine being told that there's little to no research for the condition that even exists, making it difficult to try and figure out what to do next. The reality is that for so many rare conditions, finding specialists who understand the condition and being able to make informed treatment decisions for their child is very challenging. Each episode, I will help with my network of physicians and medical resources across the U.S. to attempt to connect the dots by bringing widespread recognition of rare conditions and connecting families to the best treatment, clinical experts, resources, and support. I'm going to highlight these hard-to-diagnose diseases and offer in-depth awareness for families of children in the rare disease community. I believe we are all in charge of our own healthcare, and pushing for answers and creating awareness for these various rare health conditions can make the world around us a better place. Not only am I a huge advocate who seeks to spearhead the fight to bring rare conditions to the forefront of research, but I personally had my own rare condition. In this rare condition, I was able to be cured of due to early detection. My passion to help others was fueled by that experience, and it has led me to start the Hatching for Health show. Now, this show is a vehicle for us to create awareness to help these children find cures. Welcome back from the break. If you've just tuned in, we have Dr. Pavon Grover here, who is an interventional pain specialist right here in Houston, Texas. So we were talking a little bit about the various, pain treatments, but also I think it's important for those watching, like pretty much anybody could come see you based on whatever insurance they have. I mean, you guys are in network with all the major carriers, Medicare. So
that's a good point, because it's so confusing now.
Yes,
which insurance, where you can go. So it's
what's getting me choked up a minute ago, because I was like, it's like, even for me, I'm on this new insurance plan, and I'm like, I need an OBGYN, and I'm trying to look it up, and it's just difficult. Like, you just want to be able to, if you want to see that doctor, you want them to be in your network. So it's nice when you are, So
you brought up a good question. Like, which specialist do you go see? Right?
Yeah.
So, for example, if you're having what's the order of doctors that you see as you go along? I mean, do you see a neurologist? Do you see an orthopedic, pain?
Yeah.
And then a lot of times, what will happen is inherent in our medical system, but like everything's so specialized, right? So like if you go and they probably will have like people that treat the right foot and then the left foot, things like that. But you say you go to a neurologist, they put you on some medication. Let's say you have some sort of like problem, like your stomach is upset, right? Then you go to the GI doctor, they'll do their barrage of tests and they'll treat the constipation, right?
Yeah.
Then let's say you start to have a little seizure, then you go to the neurologist. So the inherent problem is then you have patients that are on like 10, 12 different medications, one treating the other. So it is very confusing. As part of this specialization is like, which doctor should you see, or
exactly. And then where they kind of based on needing a PCP referral, those kind of things too. I mean, I think it's great at primary care is where a lot of things start and you learn problems, but if you are obviously having a certain kind of problem, you kind of know what specialist you need to go to, right? But yet I would need the PCP referral. So let me go find that,
usually the family doctor is the good, right? Like starting point, because for example, if you're having, pain, they'll want to first rule out like any sort of, medical issues or all that stuff. So once like you're clear from that, then usually family doctors are good at.
And they'll kind of get that imaging diagnostic test like underway so that they then are like, okay, we need to get you set up with pain management or orthopedic. I feel like they kind of help that too, so that by the time it gets to you, you're not, well, I got to see the imaging. I can't really do much with you. So it does help get the
usually
process
when we come
started.
in, they've gone through the conservative things in physical therapy and chiropractor, and they still have pain. And then usually surgery is not your first step.
Correct.
That's more of there's only a few conditions where, let's say you're getting severe weakness that you need to go to the surgeon and get that evaluated. But most everything else, you can treat. You can treat, try to fix it without surgery. What we basically want.
I would agree. It's kind of the direction you want to avoid at all costs, just with the downtime, but sometimes it's just have to happen. And you work with a lot of like orthopedic extremity doctors, spine, neuro.
Yeah, so I think not one specialty has the answer to every problem, right? So it's really like a team approach. So like you have neurologists that you work with, orthopedic surgeons. So after you go through the process, this person really needs this specific problem, and then you send it to the appropriate specialist, and everything's already all worked up.
Yeah, it's like a team effort.
You got to be a team. It's one doctor or woman is not going to have all the
solutions. Yeah, solutions. We said at the same time. So I know.
So we're completing each other's thoughts.
Yeah, I know exactly. I want to talk a little bit about. I want to call it a hobby, but for you, it's really not a hobby. I mean, so you do acting, which is fabulous, but really you're a phenomenal writer.
Oh, thank you.
So you have recently written, really a movie, and tell me a little bit about that, because I know it's in kind of the top, I want to say the top 10 in Hollywood as far as like,
for me, that's a hobby. I love medicine.
Yeah, I know, you're so dedicated. If you were not a doctor, you would have,
And it's like, I think if I help somebody, right, that good karma will come back to me in other parts of my life, right?
Yeah.
But I've always been, as you have, creatively, it's one artist to another. It just like you sometimes need to do it.
Yeah.
Right? And so I started, learning how to write, right? And taught myself how to write. And then, we've done now, then I done some acting, right? So we have a couple of projects. We did one with Dennis Hopper with MGM, 20th Century Fox. We did a movie with Mark Wahlberg called Deepwater Horizon. We were involved in Nicolas Cage film, a big movie called Odd Thomas, based on the Dean Koontz books. But I have 3 projects going on right now. Right?
Okay.
One is an action film that I wrote. We actually confirming Alec Baldwin's dates. So we'll probably shoot that in end of September.
Okay, where will that be shot at?
Probably we might shoot, most of it we're going to shoot in Baton Rouge. because
Okay.
it's a hostage drama on a 767 called 97. So we have a studio set.
Yeah, with a plane there.
We have a 767. It's actually the plane from Lost. Remember that TV series?
Yeah.
So we were in pre-production on a film. This set we had gotten for that.
Okay.
The film got delayed, so we took it to Louisiana, and it's a full studio set, right? That we do. So we're going to be shooting on that. And
is that going to start this year?
September.
September.
End of September.
Okay.
Yeah. So
just around the corner.
Just around
is
the
this
corner.
the one you're going to find a way to fit me in?
Yes. Yes. That is
Yeah.
what we're
No. I
gonna
mean,
put
like
you
you're
in.
talking about the cast and then the storyline. I'm like, wow, it's going to be.
And then we're
really
doing
exciting.
we're doing a Wizard of Oz remake, right?
Yeah.
It's like a science fiction reimagining of the Wizard of Oz as a TV series.
Yeah.
And then I'm doing another film which is about the conflict in Kashmir. So it's fun for me. Instead of playing golf,
you go and
I
like write
and produce, and
get
it doesn't
on
take
set.
that much of my time because it's not like films are going constantly, right? It'll start and stop, and then it's only we shoot films very fast. I mean, usually within 30, 40 days.
Yeah, once it's all put together
so-
like that, that's like the fun part. It's the writing and casting it. So are you going to be producing or essentially? Because I don't know how that works when you write. Do you produce as well, or is it sometimes you hire a producer?
I wrote the script. I'm co-producer, producing it. Acting in it for fun. But so in all these projects, like I said, I'm involved in some way, either producer or writer. It's fun for me. I enjoy it. You love that too.
I know.
This
I
is
know.
Your passion.
Definitely. I love. Right now, it's like I love sharing people's story and inspirations and stuff because I think a lot of times it triggers other people's inner being when they're watching and they're they just kind of have that aha moment of something that they want to do or be a part of. But
also is I think if you do something creative, it's interesting even for like stress relief, right? I find myself like maybe sometimes focused on like when I'm on the weekends, writing, you have that kind of puzzle that you're trying to figure out. So there's just less time to worry about little small things.
Yeah,
right?
because you kind of consumed your mind with
with something
that
more
project.
positive, so you're not And I think in terms of mental health, this last year with the COVID, it's been it's been devastating to but a certain extent. I think it also slowed up time where people could reevaluate. Right, because we're in such a go that sometimes we don't have time to sit back and say, well, what do I really want to do? Where do I want to before it's like
it's just kind of slowed things down, put a lot of things into perspective, and I think even with myself there was a lot of things I just was like, I need to carve that out, like
what
that's just too much.
What did you
it was with like with all the healthcare businesses and stuff. We have the imaging center, obviously, where we have the med spa, but there's a part of business that I would do that was kind of catering to other cities. For example, attorneys were, can you help us schedule a patient in San Antonio or find us a spine surgeon in Austin? And we we're constantly not focused on our core business, trying to solve these a lot of time attorneys.
So do you
problems.
think mentally and emotionally you had a little time to
it was
reprioritize what you wanted to do with
exactly. And I think even my staff appreciated it because they were a part of that internal / external scheduling, and like with you, like you come and work with us. It's so nice to have like a doctor of your stature actually come into our clinic and we have clinic with you.
Clinic's great.
So versus having to refer it and did they show up, did they not show up, like anything you can I'm sure
you have a great team there. I mean,
like when you can do it under your roof and really control like all the variables, I feel like you're always going to have like a better turnout. So similar like with the whole movie stuff, like the more things you're writing it, you're producing it, the more you're like have control, like you control the outcome. So there's a really part of that I'm really appreciating, and I think COVID it took time to kind of have that be an eye opener, I would say. So what are your plans right now? I mean, you're consistently growing your practice, and you have an anesthesia company alongside your pain management practice. So you guys work at various hospitals providing anesthesia, because that was really your first medical degree, the anesthesia side. So you still utilize that, overseeing that company?
Yes, you know, so that was a foundation, which was anesthesia, which is the right foundation for what I do, because you know we know about regional blocks and all that kind of stuff. So for interventional pain, it's a good background. So you know, I love all of it.
It's great. Fun. I love working with you. Thank you so much for being here. I know we do have to wrap up. I feel like I want to like talk about a million things. We'll have to have you back. But thanks for your time and coming out. And you're, I guess, so if people want to find you, what is are you on Instagram or Facebook, or what's kind of the way people can look you up?
Just the office. You know,
no, you can just Google Pavon Grover, and that's PAWANGROVER, and you will
if you Google the other one,
you'll go right to
PAV goes to all the movie sites.
Oh yeah, is that what you do? The PAV with?
That's just you know, that's like my.
Okay, so you might find him under PAV or PAWAN Grover, and he is a wonderful doctor here in Houston. I recommend seeing him, and thank you again for being here.
So do I have to talk to your agent, you know, about getting your acting role? You're gonna be like J-Lo. I'm gonna get you a like, you know, a certain curtain count. You know, no brown M&Ms or something like that. You're gonna be difficult.
No. As long as Kay's with me, we're good. Okay. Are we still on? No, we'll be totally good. So
I'm teasing.
No, thank you for lightening the mood here, though. We you know, you fix pain, but you also bring, you know, a certain spirit. So it's nice to be around you. So
thank you so much.
Thank you. Absolutely. Well, we hope that you enjoyed this episode, and if you'd like to reach out, as I mentioned, you can look him up online, Dr. Pavon Grover. Probably drpavongrover.com, possibly. Yeah. Maybe so. Yeah, but easy to find, and you can see him in Bel Air as well as Houston or Memorial City. So thank you so much for tuning in. We'll see you right here next week at 7:30 p.m.